Primobolan versus Masteron, which one do you pick for your bodybuilding needs? Common questions I get is which compound to pick out of these DHT derivatives? And a big guider within this is going to be access to quality. So Masteron versus Primobolan, quality considerations. Now, Primobolan is still a prescribed drug and you can get pharmaceutical grade. However, it's extremely difficult to do so and lots of counterfeits are present on the market. So usually most people are left with underground labs for Masteron or Primo. Now, the next best option would be if you had some type of HPLC tested Masteron or Primobolan that you could verify. However, the problem around this is that, was it just that batch that you got tested? Then if you got another new batch that might already have a degradation to the quality or might not be real, the choices around these would then come down to just what might be more liable to be fake. And Primobolan, being that it's more costly compound, and just historically has been more faked and counterfeited. And I've seen more HPLC tested coming back as boldenone than actual Primobolan, would lean me to then pick Masteron in that instance. So one for Masteron in this case. So I would always go pick with what was real. That would be the biggest guider here, especially for females. We also would consider Primo versus Mast, which one would be more benign in side effects. And being that Masteron and Primo have both been deployed in females, and comparing this research and the history of these compounds, does seem that Primobolan has been used up to like 1,200 milligrams per week in females and caused pretty low virilization side effect. So being that Masteron likely has a more androgenic component to it, that might be why we see more issues around lipid alterations or peel reporting issues with hair or maybe even acne. Now, with the compounds though, there is inter-individual variability. So you might, although Primobolan on paper might be more benign to you, maybe you had more issues with Primobolan. So it is a case that you do need to run each compound possibly individually with testosterone as your base and see which one you get along best with, result effect-wise and health marker-wise. But on paper, Primobolan seems the most benign as far as side effects go. So a win around for Primobolan. Which one to pick around estradiol control? Now, both compounds likely has some contribution here with some competitiveness for the aromatase enzyme, to where you wouldn't have as much of your testosterone converting down into estradiol. So we have seen lower levels of estradiol on when you have Primobolan or Masteron even present. Now, being that Masteron was used to treat females for breast cancer and have this aspect of offsetting and modulating estradiol, or maybe it is with preventing some of the aromatization of testosterone to estradiol, whichever it may be, Masteron was the drug of choice to do so. So being that Masteron is more androgenic, likely it might have more of that offset of estrogen. So you might, if you're an individual that might struggle more with estrogen issues, Masteron might be a better choice for you, or it might come down to the phase that you're in it too. So if you're in a contest prep scenario, you're trying to have an influence and shift water levels, and estrogen has a component around that driving up water retention, Masteron might have an effect to do so. Now, there's other ways to modify your stack design, just lower testosterone, or even consideration around using ARB, but that's another topic for another day. So for estrogen control, Masteron might have a little bit edge over Primobolan. Another big factor here could be tolerance of shot volumes and concentrations. Primobolan usually comes at 100 mg per mil, and rare you get 200 mg per mil and it's not underdosed, but also it's just extremely intolerable. Even the 100 mg per mil can give you some PIP, some post-injection pain, and not be tolerated too much. Now, Masteron and Anthate can come up to 200 mg per mil and is tolerated very, very well in that fact. So if you're an individual that's requiring a higher concentrations and dosages to drive anabolism, you might favor Masteron over Primobolan in that instance. Now, we have 3 wins for Masteron versus 1 for Primobolan, so it's kind of in favor of Masteron here. However, we also want to consider anabolism. We're bodybuilding. We're trying to build muscle. Who wins in this favor? And off the literature that we do have in comparisons around the Hirschberger essays, anabolic to androgenic ratios, and then even looking at some other studies comparing other androgens, not Primobolan and Masteron, there is evidence to say that on a milligram for milligram basis, These drugs build muscle relatively about the same, but where they really differentiate is going to be in side effect profiles, how you tolerate the drugs, shot volume and concentrations. So those are likely more of the guiding decisions around whether you pick Primo or Masteron versus which one is going to build more muscle, because it does seem that they're relatively pretty close in effect. Now, another point is, well, why don't you use a little bit of both? And you very well could. The fact that you could raise up your Primobolan levels, as it's likely is a more benign drug. And then as you get into that high shot volume territory and need more for growth, you start bringing in some more Masteron to make up that total milligram amount, to where at some point maybe you're just using a lot of Masteron in a small amount of Primobolan. The issue with this is that now you're bringing in multiple compounds to sort out if you do run into an issue. So you might not know if, like, oh gosh, I'm starting to feel like I'm getting gyno. Is it my Masteron or a Primobolan that's fake? Or is it just testosterone in general is the issue? It might be hard to work out, and that might be something you would leave for someone that's more advanced and can really differentiate between which compound is doing what. So likely from an assessment point of view, you're better off as your testosterone base and adding one compound at a time, so you can tell the differences if you do run into an issue. So Primobolan versus Masteron, which one should you pick? And it really is going to come down to your individual response, which one you know is going to be real, which one will fit within your safety and risk profile. And then from there, just fill in your milligram total, as they're likely driving about the same bout of anabolism and muscle retention, whether you're in off-season or contest prep. Want to learn more about PD design? Check out J3 University. We have entire lectures fully dedicated to all these in-depth topics that we can discuss in the framework for actual usage of the compounds.